It works on mood chemicals, and in the studies, it's certainly put women in the mood to have sex. It increased sexual desire by 53%. This works on the brain, unlike Viagra, which actually increases blood flow to the part of the body that needs blood flow for a man to have sex. This puts women in the mood. Women are much more complicated. This is much less straightforward than Viagra.
For 15 years, men have enjoyed the benefits of the little blue pill to fight erectile dysfunction and relish the pleasure of sexual intimacy. A decade and a half later, the Sex now has their own version of sexual enhancement drug, what's being called Pink Viagra. A pill that can increase a woman's desire for sex would seem to have passed the most important hurdle in taking it from the lab to the bedroom. However, let us temper the excitement with some rather unintended side issues. More to the story. Let's welcome in certified sex therapist, radio talker, and clinical psychologist, Dr. Judy Kuriansky to MidPoint. Dr. Judy, good to see you.
Good to see you, Ed. And indeed, the pink pill to match the blue pill. Do you think that there's some gender issues there? Pink for girls,
I never thought
blue
that.
for
Boy,
boys?
my goodness, how it never struck me, pink and blue. It's just you never know these marketing people, how they get things so wonderfully perfect just on a guess. But let's talk about this. Here's what I see, a drug aimed at helping women. No, go ahead.
Well, I was going to say, in terms of the pink and blue, that it's funny that it's blue for Viagra, because since the women are supposed to take the pill every night, this is almost like Cialis, which is another pill for men. And that's the one that they take every day so that you could be ready when you want it.
So then, in essence, isn't Viagra for women in the first place, and then this would be for men?
Well, actually, Viagra, as the report that you just heard is, what it does is that it creates more blood flow to the man's sexual organ. And that's not what the pink pill does for women. It's more affecting their brain. But we do know that sex is in your brain anyway, even for, certainly for women, which is one of the big differences here. Because what's concerning me really, Ed, is that women need a lot more than a pill. So what I worry about is that some women will think, well, I'm not turned on, and so I'm going to take this pill and I'm going to get sexually aroused. But that's not really what does it for women. It's a lot more based on the relationship than it is for men. For men, you know, they have a hard-on and they say, okay, I'm ready. Their confidence gets boosted, and then it's a lot better for them. But for women, sex is a lot more complicated.
Well, let's certainly hope they have confidence well before that as well. It would almost be nice to see that, first of all. Are we then just sort of kidding ourselves here when they're calling this the women's Viagra then? Because, as you said, for one, it does one thing, but for women, there's a whole lot more involved here. We're talking about a lot of biology here more than just, or a lot of mental, if you will, more than anything else. So this is sort of a little false advertising, is it not?
Well, you know, it's a mixture, because every sexual response has a lot of levels to it. It can certainly be chemical, as well as being psychological, and as well as being interpersonal. So all these factors mix in together and have to be balanced for the individual woman even. Because one of the problems, obviously, with the pink pill is that since it is working on chemicals in the brain that are related to depression levels and emotional mood, one has to be very careful about that. So I worry that women would rush out and say, well, you know, I'm not turned on, this is really going to help me. Or even, Ed, you know, one of the problems that happened with the Viagra pills and the Cialises and the other manifestations of that is that some guys even said, well, they were okay to begin with, but I'm going to be a real stud. So let me boost it up, really take it to a 10 plus. And
yeah,
so that's
I can't quite imagine anybody actually trying to pop these like M&Ms, but then again, I guess that's where we're at in so many cases here. I only got about a minute left.
Well, recreationally.
Well, recreationally, of course. There's the M&Ms. Here's the claim by people: a biological lack of desire to have sex negatively impacts 1 in 10 American women. Do you agree with that?
Yes, I do. It's very, very prevalent. I'll tell you, what women want is they want, from surveys, to be told they're beautiful and to be loved. And so that is really the key that all partners should know. That's really the key. And the woman should feel good about herself and her body, which many women don't, and then let her partner know how to please her. So learn what pleases you yourself, Then teach the partner how to please you. Do you like it soft? Do you like it hard? Do you like to be touched here or there? Learn about that, and that'll go a long way before you start taking pills.
So at the end of the day, enough with the pills already, for crying out loud. Everybody go ahead, find out what the other partner wants, work on that, and stop worrying about all the medication. How's that sound? 10 seconds. Did I do that well?
Okay. You did that very well. I'm very
See,
proud
there
of
you go. We're throwing all the studies right out at this point. Let's go ahead and get to the stuff that's really important here. Dr. Judy, thanks so much for joining us.
Ed.
It's you and me. Next time, we'll just go ahead. We'll set the world straight one way or the other. All right, take care. Thanks a lot. Coming up after the break, it's time to find out exactly what's important when it comes down to the end of the week. It's Friday. It's the political punching bag. There's a little humor involved. Well, at least we let the professionals do it at this point, all right? Coming up next, right here on MidPoint.